This week on Gwin's Pillbox, I would like to give you some visual helps to help you remember some of your antihypertensive medications, okay? So the first one is our beta blockers, atenolol, metoprolol. These medications end with OLOL and they're beta blockers. They block that sympathetic response that adrenaline causes, so they help to bring blood pressure down. They also bring the heart rate down. So when we think about side effects for these beta blockers, remember the 3 B's. Bradycardia, bronchospasm because of the beta receptors in the airway, and blood sugar. They can bring the blood sugar down. They also can mask symptoms of hyper or hypoglycemia because those are sympathetic responses. Okay, so we have our beta blockers. Next antihypertensive we have that we talked about in our lecture are our prils, our ACE inhibitors, lisinopril, enalapril. Pril is our ending. So if we think of the calendar, the month of April, we have an A for our ACE inhibitors and pril is our ending. A is also for our adverse effect, which is angioedema. That would be swelling in the face, the tongue, the lips, all that. That's an adverse effect, a very serious side effect. When we did our mnemonic, we have a face on our calendar with 3 lines. So there are 3 side effects we need to remember with these. That's headache, cough, and taste disturbance. Also with the month of April, we have a P on there. We have to be careful with pregnancy with these medications and also watch your potassium. When we interrupt that renin-angiotensin-aldosterone system like we do with these meds so that we block that vasoconstriction of angiotensin, we can cause hyperkalemia. So watch your potassium levels. Our next medication is pretty close to that. That's an ARB, an angiotensin receptor blocker. We allow the conversion of angiotensin 1 to 2 happen, but we block the receptors so that it can't get in there and cause, again, that vasoconstriction. Side effects are just about the same as your ACE inhibitors. They can cause a little sinusitis, rhinosinusitis. Adverse effect is still the same. That is your angioedema. So these are our ARBs. I have it on a mighty shield because I think of Spartans. These end in sartan, like losartan, valsartan. Those are your ARBs, or angiotensin receptor blockers. Again, they're antihypertensives. And with all these hypertensives, make sure that you always just keep in mind they can cause hypotension. I just don't put those in the mnemonics because that's kind of a given, okay? Next one is our calcium channel blockers. Calcium causes muscle constriction and vessel constriction. So if we block calcium, we give calcium channel blockers, we're going to create vasodilation. We're going to decrease the workload of the heart and we're going to decrease our blood pressure. These medications can also be used for arrhythmias. The mnemonic for remembering the side effects for calcium channel blocker are CCB, cabeza dolor. Because of vasodilation, these can cause headache. Next is constipation. There are calcium channels in our intestines, so these medications can cause constipation when we block those channels. And lastly, again, is bradycardia. So we must assess blood pressure and pulse before we give these medications. If you remember from the lecture picture, there was a pine tree in the background. These calcium channel blockers end in PINE, amlodipine, nifedipine, okay? And if you remember on the tree, there was a grapefruit. No grapefruit juice with these medications. There are a couple exceptions to the rule for the endings for these meds. Ditilazam and verapamil. Those are also calcium channel blockers, but they don't end in PINE. Lastly, I would like to just give you a little visual here about our diuretics. So can you see the salt there? We have salt and water. Water follows salt. So if we have medications that cause you to excrete sodium, that block those channels or increase those channels, if we dump sodium, we're going to dump water. If we hold on to sodium, we're going to hold on to water. So that's just a general rule. Another general rule about your diuretics is always consider the potassium level, okay? Important electrolyte, has a profound effect on our heart. Okay, those loop diuretics and those thiazides, those will deplete potassium. Our potassium sparing, like aldactone, those can cause hyperkalemia or high potassium. I hope these visuals help. help you remember these important antihypertensive medications. And that's it for Gwyn's Pillbox this week.